Hello, my name is Kai Romero, and I'm a third-year PsyD student at Hawaii Pacific University. The goal of this presentation is to investigate current health data surrounding substance use in Native Hawaiian communities, as well as the opportunities for care utilizing psilocybin. We will explore the history of substance use in Hawaii, the current impacts on these communities, and ways to improve outcomes utilizing psilocybin. The number one drug here in Hawaii is crystal methamphetamine. It is the most common addiction to be treated in our rehabilitation centers. This crisis is endemic. Houseless and displaced people comprise 15,000 people in our state. Many people are often flown to Hawaii from the mainland because it is considered an easier climate to remain houseless in. This has also become an issue in regard to available services for this population. With such a demand in these placed on the system, many people go untreated. We see all too often that meth use in these communities is commonplace. The drug helps this population to sleep less and stay on guard throughout the night and is highly addicting. This type of substance abuser places a great strain on our medical systems. These people are disproportionately Native Hawaiian and could benefit from alternative treatment methods to manage their substance use instead of placing greater strain on our medical institutions. 38% of drug treatment admissions in Hawaii are for stimulants, to include methamphetamine. Additionally, 8.76% of Hawaii residents report having used an illicit substance, not to include marijuana, in the past month. These stats indicate how prevalent substance use is among our residents and how it disproportionately includes Native Hawaiians. Effective outreach and accessibility are key, but they don't always happen. Oftentimes, people remain unaware of the services that do exist. With the incorporation of therapeutic psilocybin, there needs to be equal access to all. I will also discuss concerns regarding mental health equity and the future of psilocybin in my presentation. We need more providers, more centers, and more treatments to help soothe the epidemic. The benefits of psilocybin for substance use disorders are becoming more apparent with more research. We know that psilocybin is considered a lower risk treatment when working with substance users. Studies are showing that psilocybin can be effective in smoking cessation, opioid and opioid and stimulant addictions. There are people who feel as though they've quote unquote tried everything and have run out of options. Expanding the therapeutic use of psilocybin could help change that. When considering the potential benefits to Native Hawaiians specifically, multiple considerations need to happen. Most of the substance abuse services exist on Oahu, which means that there are provider and center deficits on the outer islands. In fact, someone may need to be flown just to Oahu just to access services. If a person is displaced or houseless, this may be impossible. The Hawaii State Legislature is moving forward with allowing psilocybin to be used in therapeutic centers. Ideally, we'd have centers such as these on the major 4 islands, being Big Island, Oahu, Maui, and Kauai. The traditionally held values of Native Hawaiians may be better expanded when using psilocybin, bringing a connection to spirituality that may not have previously existed. So in this presentation, we're going to talk about the current status of substance use in Hawaii, the benefits of psilocybin, and some comments on health equity and accessibility. So to start, the legal status of psilocybin in Hawaii, our Senate recently voted unanimously to establish a working group within the state health department to develop a strategic plan to ensure protection, accessibility, and availability of psilocybin for therapeutic use. Currently in Hawaii, we have ketamine centers for treating depression and PTSD, and this legislation is meant to expand those options for people using psilocybin as well. So there are some things we need to discuss when considering psilocybin in marginalized groups. In one study, I found 43% of Indigenous women sampled said they were interested in receiving psychedelic assisted therapy. More than 80% of the research in the field consists of white people. and 14% reported that psychedelic experience increased their current state of well-being. The data on the researchers and participants within the field of psychedelic medicine research show us that it is predominantly white researchers and participants, excluding the whole demographic of Indigenous persons. And we see here too with this data that people are interested in receiving these therapies as alternatives to Western medicine. So this little chart here just shows some of our primary care drug admissions. This is going back to 2012, so it's a little bit dated, but we see here on this purple line that stimulants are on the rise and steadily increase in terms of our drug treatment admissions. We see that marijuana has sort of stayed on a flatter path, and we see a decrease in cocaine and heroin addictions bringing people into treatment centers. So marijuana consists of 12.62% of the population. People being brought in with cocaine use are 1.99% of the population, and heroin is only 0.23% of the population. So this data really indicates that Hawaii needs to get a better handle on their methamphetamine crisis. Discussing harm reduction within these Native communities is also super important. We have King Kalakaua in the late 1800s, who stated that prior to white settlers coming to Hawaii, there was no fatal disease or epidemics, that the Hawaiian people were relatively healthy, and that these diseases were carried over from foreign places and not homegrown. Like the chart showed us, meth is the #2 treated substance abuse disorder here in Hawaii. We also know that 35% of men incarcerated are brought in with meth in their system. And there should be an effort to decrease cultural stigma. There is a lot of distrust in medical providers just based on the history of white settlers coming in and basically whitewashing Native Hawaiian practices. So increasing the availability of services and the knowledge of services could aid in harm reduction. This little chart here just shows the overrepresentation of Native Hawaiians and Pacific Islanders in our prisons and jails. They comprise 39% of the incarcerated population, so highly overrepresented. Native Hawaiian views on substance use are pretty interesting. So we see this triangle here, which is considered the lokahi triangle. And so it incorporates physical, emotional, and spiritual needs. So we see Ke'akua, the gods, Aina, the earth, land, and nature, and Kanaka, which is humankind, which make up the 3 components of the triangle, but they all come full circle. They all depend on each other to operate well. So like I mentioned, there is some historical and cultural trauma that influences even the modern generation, hearing from their relatives and family members about their treatment since Hawaii became a US state. It can be really disheartening for youth in terms of seeking substance abuse treatment. We see that there are low rates of voluntary participation. Most people are brought in through the legal system. For Native Hawaiian communities, having the family and community involvement is super important. We see in some Western cultures where it's just the individual who makes their health decisions, but for Native Hawaiians, the community and the family should really be involved because they comprise the entire person's identity. It doesn't just leave the sole responsibility on one person. There are certain risk and protective factors here. I think some of the protective factors go back to that community and family involvement. I think risk, we could look at genetic data, predispositions, and things like that. In addition, for risk, I think we need to consider the lack of available centers and providers. So why psilocybin? Why investigate this treatment specifically? So as many of us know, it activates the brain's visual cortex. It is the safest of recreational drugs. We see it integrated with CBT now, creating these sort of safe spaces. And it also stimulates new brain cell growth necessary for learning and change. And that's what's really integral about being hopeful about this treatment for Native Hawaiian communities. So, in looking at the research is not overwhelming. It is pretty limited, but we're seeing more and more data come out for these specific Indigenous populations, which is awesome. So, we see in the US in general, overdose deaths in 2020 were 59,000. With utilizing psilocybin, there are some perceptual, cognitive, emotional, and ego dissolution that happens, and we see the activation of the 5-H2A receptors. Peters and Olson in 2021 talk about the mystical experiences, that connection to spirituality, which I think could really help connect Native Hawaiian communities to this treatment. And just using that activation of the prefrontal cortex that can help regulate drug seeking behavior, which is a way to be more proactive in this treatment. So, how can Native Hawaiians specifically benefit from the therapeutic inclusion of psychedelics? So, like the data on the previous slide shows, the substance use disorder numbers are increasing annually. We need further legislature to increase psychedelic resources. Psilocybin, like I mentioned, adds that spiritual component. So when we talk about Keokua, the gods, that can also be incorporated into the mystical experience. And it's also an alternative treatment method when all other options have been exhausted. If you are someone that's on an SSRI, for example, if you're dealing with um, substance abuse and comorbid mental health disorders, well, if you keep coming into that office every 3 months in order to check on that medication and continue to take the medication, that is not the most cost effective way of doing things. Things can be more cost effective by utilizing psilocybin, which may require limited treatment sessions as opposed to regular therapies. So for Native Hawaiian communities who may be seeking an alternative to Western medicine, psilocybin can be really beneficial as well as other psychedelics. Health equity and accessibility is super important here. So we're seeing this recolonization of psychedelic medicine. We're seeing big pharma step in, investors step in, and these are predominantly people of European descent. So, like I mentioned with that whitewashing, it's really important to keep the voices of Indigenous people alive because they're the ones that inform our safe use of these substances. They are the ones that have utilized them for generations and generations and have these resources available to help guide us in maintaining this psychedelic renaissance, but also preserving Indigenous rights and quality with these psychedelics. We do see structural inequalities which perpetuate these problems and draw bigger divides in equity. We see that with Native Hawaiians being beneath the poverty lines, again, being disproportionately overrepresented in negative aspects of the structural inequalities. So paying a close eye on health equity and accessibility will make sure that when this treatment is expanded by the state legislature, that everyone has equal access to it, regardless of any other barriers. So just to show you what I mean a little bit about underserved areas, you will see that the outer islands are all highlighted in dark green. They're all underserved areas. We have people who come to Hawaii to study for a few years, get their degree, but most often go back to the mainland. So Hawaii is not doing as good of a job at retaining its clinicians and students who are graduating from these programs who could be of benefit in the mental health and substance abuse treatment world. For Oahu, you see most of it looks like it's pretty well served, but our North Shore and our West Side still remains largely underserved and needs areas and clinicians in these areas to further thrive. So there are definitely some barriers to care. As I mentioned, Native Hawaiian people are among the most medically uninsured, impoverished, homeless, and incarcerated populations in the entire state. We have to consider geographical location. If someone is on Maui, They may have to fly over to Oahu. Well, who's going to pay for that? If someone is houseless or displaced and they want to get substance abuse treatment, they may not be able to because of those financial and geographic considerations. That ties into transportation. We have a lot of people who use public transportation, use the bus, don't have cars. So having clinic hours that are available, not just Monday through Friday, 8 to 5, would be helpful as well, so that people can set up transportation. And we also see here in Hawaii how families usually work 2, 3 jobs just to provide basics for their families. So expanding hours outside of that 8 to 5 could really be helpful. Even just setting up 2, 3 hours on a Saturday can really benefit this population. And again, there's the lack of providers and psychedelic therapy centers. So we need to see more activism in regard for that and trying to keep our providers here in Hawaii. So then we can go on to consider next steps. So within this field, in the field of psychology in general, we're very interested in creating culturally mindful clinicians and researchers. We want to increase diversity of research participants. We can do that with effective outreach by providing financial incentives. That may be a way to incorporate more Native Hawaiians into research projects, because if someone has to take time away from work to dedicate time to a research project, well, then they're missing out on money. So sometimes having a stipend or something beneficial to the participant could really help increase that diversity. We need to incorporate psychedelic values to balance out capitalistic efforts, and incorporating those vulnerable populations into research work. I know for a lot of clinicians too, we're worried about traffic, time to get places, but if you're willing to go the extra 10, 20 minutes out of your way, you can really ingratiate yourself in a different community that's maybe more vulnerable and deserves more prominence of care. And of course, we should always be doing more and more research. Here are just some references. I appreciate your time and hope you've learned something today. And I'm excited for questions and answers later.